We have a final next week. Rudy, have you announced any office hours for the coming between now and next Thursday?
No, but I will keep it as it is on Wednesday.
Okay,
So that will be, after your review session. So
sounds good. So you'll have office hours next Wednesday.
mhm,
Sounds
yep.
good. Okay. And I'll have office hours next Tuesday, and I'll have office hours this Thursday. So if you need anything, um, let's see. I put all for the final. I put everything online this weekend, so you should have an article. Here, I'll show you what I put on there. So this is the article that I put on. Health-related variables in academic performance among first-year college students, implications for sleep and other behaviors. So like the midterm, I'll feel free to ask you about this article. So just read it over carefully, and we'll give you a copy of this article when you come into class for the final. I also put online a lot of materials, study guides. So let me go through it here. So these are the terms. You can see Rudy, can you see the slides here? The research methods slides. I'm assuming you can. So here's the terms to know from the first part of the class. And then here's terms from from after the midterm. And things that we'll cover today and covered through. So the lectures will go through Thursday. So what will be on the test will go through this coming Thursday. And then through the book down here, I've highlighted some of the chapters that were relevant from the book. Again, the way that we'll use the book is that I won't ask you about things in the book that we didn't cover in class, but I'll expect that you have read things in the book that cover the chapters. The final will be in class. So just like last time, come on in, we'll give you a copy of the article, give you the test. It will be from 9 to 10:15. Any questions about the final? All right, well, seeing nothing, I'm assuming that all is good. The other thing is let me do a new share for you. So the survey is done. So this is what Qualtrics looks like. So the way that, when you go into Qualtrics is that, you basically set the survey up like this. So this is what Rudy set up. He put in this, and then you have all the questions. And sometimes you have kind of, like you have skip logic. So if they said no, that they don't have a minor, then they just went on to the next question. But if they said yes, and so see how he did carry things forward and such. So this is how you set up a Qualtrics survey. Then for the data, here's what the data looks like. And so we'll export the data, export data, and we'll use numeric values like that. So we'll wait. And then what the data looks like when it gets open is, it looks like this. So you can see the data okay? Give me a thumbs up if you can see the data okay. Okay, great. So this is what it looks like when it comes out. So you have basically the start date, end date, and then what it does is that for all the, here's what the question is, like here, what grades do you think you'll get in your class? And then it asks people about, the grades, etc. So it comes out as numeric like this. So what we'll do is that we'll go through and when we put it together is that then we'll you know, analyze the results this way. So on Thursday, I'll give you some of the results from it. So well done. We had about 78 responses, I think. So that's good. You know, there'll be enough to kind of say something there. And then, we'll talk about that on Thursday. Any questions then about the survey or anything else? Okay. So for the last part of the class, what I wanted to do is just to talk to you about what type of careers in public health or what type of research is done regularly in public health departments. So a lot of you, and not just public health, but also just general health departments. I think a lot of you, I assume, are going to go out there and look for jobs. And that public health departments are chronically in short of, in need of people, and they really need people who can understand how to do data stuff. So, you know, my suggestion would be is that if you want a job in the public health department, is to know a lot about what type of data that they, you know, what kind of research that they do, and how to go through and do some basic things with data. So that's why Excel is really good to do that basic type of things. If you can do research where you work on different types of projects, it's really good because then you can kind of see what they do. So I thought what I'd do is I would go through today, and probably it will last into Thursday, just some basic type of overview about the different types of research that's done in public health. And we'll cover these 4 things. We'll cover surveillance, needs assessments, monitoring, and then program evaluation. So just to remind you, as I think I talked about this first day of class, as I said, well, you know, if you want to think about, well, where is it that public health kind of fits into, you know, the different parts of public health fit into our healthcare system, is you can think about what's called the policy cycle. And the policy cycle means that, you know, you have things that determine health, and that from that, then people get needs. And then our health services, like, you know, doctors and hospitals and such, respond to those needs. And that some of those needs are met and some of them are unmet. And so then you identify the unmet needs. Then it goes into a process where someone prioritizes what they want to do about it, you know, to try and meet those unmet needs. And you get some type of response. It's called a policy response, but, you know, it's really could be, you know, like a hospital could see that there's unmet need, and so they could change the way that they're doing things. It's really anyone, but you have some type of response. And the response means that you either change funding to fund different types of things, or you provide different services, or you provide more services. But then that leads to some type of intervention or program or policy or something that happens. And that something can either happen at the sort of to change the fundamental determinants of health, or it can change the way that the healthcare system revolves. Well, if you look at public health is, you know, 5 areas, right? Epi, biostats, environmental health, health promotion, and health services research. If you think about those 5 areas, well, what Epi really does determinants of health, right? So when you come out with an Epi study that says, you know, drinking red wine is good for your heart, that's what they're looking at is, well, what determines health? Environmental health also does pretty much the same thing, is that they come through and that they, you know, they look at the different types of environmental determinants of health, but most of it is environmental epi. Health services research kind of looks at the you know, the process of what our healthcare system does in response to it. And then also health services research identifies unmet needs from that. So, you know, when you look at our healthcare services meeting the needs of people, when you find out that they're not, those are unmet needs. And so from that, then, you know, health policy then usually looks at kind of what the response is going to be to that. And so, and also health management goes into this too. So if you're interested in health management usually talks about how the healthcare system responds to, you know, how hospitals and people like that respond to healthcare needs. But it's the same type of process of whether it's the government or whether it's within a healthcare setting in health management. What they're doing is they're trying to figure out, all right, so how do we improve the system to kind of address these unmet needs? And that leads to some type of change. And so the interventions then, like health promotion, health psychology, those are all things for which what they're doing is they're trying different type of programs. So that kind of goes into the interventions. The interventions, either they're successful or they're not successful, they get implemented at the determinants of health stage or the health services stage. But essentially, coming through and looking at those type of interventions is to see if they're effective and identifying and reducing unmet needs. So in thinking about the different types of research that's done then, determinants of health and EPI, that's where we're going to talk about surveillance and how they go through, how epidemiologists and public health departments basically monitor the health of the population. That's all determinants of health. Identifying needs is we'll talk about how different hospitals and public health departments and other entities come through and they do needs assessments. And the needs assessment, then what they're trying to do is to say, well, of all these different types of issues that people are facing, what are the things that, how do we summarize those type of needs? Health services research then does evaluation of the healthcare service. So when looking at is a certain type of treatment more effective than another type of treatment? That's all basically evaluation of the healthcare system. Health policy then gets into this area. Health policy, they do research in health policy, but it's not, it's typically not like the same as this type of research. And then interventions, this is where you would, they would try different things. And then what they do is they evaluate them, right? The evaluation could be randomized controlled trials, but the evaluation could also be when they get implemented here, as they could be evaluation when they get actually, effectiveness evaluation. Okay, so start with surveillance. So the definition of surveillance is basically continuous systematic collection analysis of health-related data. Right. That's so, and there's lots of different agencies that do surveillance of health. Like this is the World Health Organization, who obviously they do surveillance at the more international level. But then you also have within the U.S. you have the CDC that does surveillance, and you have local public health departments who do surveillance. You have hospitals who do surveillance. So there's a lot of people who do kind of surveillance. This is sort of bread and butter epidemiology. But even within that, there's different types. So if they think about, well, what is it that you're going to go through and actually look at, right? Well, one thing you could do is you could look at indicators. So indicators means that something that you can measure that has some type of relationship to your health, to your health problem. So, for example, number of new diarrhea cases, right? Percent of children immunized in a district. Those are both things that they're indicators about what future health is going to be. If you see lots of kids who have diarrhea, then you think, oh, well, we've got some type of health issue. We've got rotavirus or something like that that's going through this community. Those are indicators. Active surveillance is when you try to go out and collect the information. So indicators are things that you kind of just can monitor along the way, but active surveillance means that what you're doing is that you're going to go out there and you're trying to figure out, like, for example, just calling up primary care doctors and saying, how many cases of this have you seen this way? That's active surveillance. Passive surveillance means that it's a system by which you're getting some type of routinely collected information. So, like in California, we can get all the state hospital data. So we get, for all the hospitals in California, they all have to report their data to the state, and the state then makes that data available for researchers to look at. And so within that state hospital data, it has what the person, the diagnosis, has various things about their health outcomes, and it's got things about their what procedures were done to them. So if you want to go through and figure out what's happening with hospitals, in the hospital, that you can look at the hospital data. That's basically passive surveillance. So public health departments, they do active surveillance, like TB testing or TB tracking. That's active surveillance. Passive surveillance would be looking at routinely collected data to see whether or not you can pick out different types of conditions that are prevalent in the population. So you get your routine health services information. So this is like the hospital data. That's routine health services information. You also then get other types of information that are out there. So public health departments often use health information systems. So like, Golden Valley will have their health information system. Mercy has a health information system. And so, usually the Medi-Cal purchaser in the state, but in theory, the county could come through and look at both of those databases to get a sense of what's happening routinely. And then there's syndromic surveillance. So this is what they've, I think the push is now within public health departments is after COVID is to get more real-time type of information. So one way that this could happen is that the public health departments could be linked in to the primary care databases. So like if you go into Golden Valley and you have the flu, and it's that when they enter in, into their system that they get the flu, it gets pinged to the public health department, and the public health department then can see, oh, we've got these number of cases of flu that are showing up in this area. That's syndromic surveillance. As you can imagine, it's hard to do because you've got to connect your information systems, but it's really good if you're, it's really important if you're trying to stop infectious diseases and to see where infectious diseases kind of coming to the forefront. Now you can imagine that during COVID, this became a really big issue, is that could they come through and actually get real-time information on COVID? And so some places they did pretty well, like from what I understand, Santa Barbara County had a system whereby the public health department could see when people were coming in being diagnosed with COVID. But that's because the public health department basically runs the hospitals, the main hospital system in Santa Barbara, or at least the main public health system. In Madera struggled because the community medical center down there, community hospital, didn't really have information systems that were linked into the public health department. So in Madera, they couldn't do any type of syndromic surveillance. All they could do is basically just sort of do passive, they could do this type of active surveillance where they were calling up and trying to figure out how many people are having COVID. But you can imagine is that this is not a very good way to actually stop an infectious disease. What you want is something like that, where you can get much more real-time information. So after taking Epi, when you go out there and get a job in the public health department and they start talking about surveillance, that's what they're talking about. And if they start talking about syndromic surveillance, then what they're talking about is like, can you get real-time information from healthcare providers? All right, so I'll give you something to look at, which is basically from the World Health Organization. It talks about essentially how to do surveillance in emergencies. If from my kind of looking at the way that public health is going to go in the next few years, is that public health in the last 20 years has been public health agencies in the last 20 years. What they've done is they've kind of responded a lot to different types of health issues that came along. And so, public health has always been the agencies have always kind of filled in the gaps where the healthcare system, where the healthcare providers like doctors and hospitals didn't do a very good job, or didn't really, that wasn't their focus, put it that way. So diabetes prevention, chronic disease prevention in general has been a real big focus of public health departments going forward. I think what happened with COVID is that, they realized when COVID hit is that public health departments weren't really set up very well to do more contagious disease surveillance, at least not as much as they needed to. So I think there's going to be a shift over from chronic disease focus to more severe contagious disease focus in public health departments going forward. So if you're looking for a job in public health departments, I think it'd be good to go through and to understand kind of what surveillance is and how it's used in public health departments. And there's lots of information out there about it. So I've given you some, but you can easily find others. All right, so that's what the basics about what public health does, is they do surveillance, right? That's the main type of documents that they come out, or reports that they come out that sort of summarize this, is their needs assessments. So public health departments, they all should do, not all of them do, but they all should do every couple of years a needs assessment. it's called a CHIP, Community Health Needs, there's a Community Health Improvement Plan, that's a CHIP, and there's the Community Needs Assessment. The Community Needs Assessment, what they're trying to do is they're trying to summarize what the needs are in that county, basically. The Community Health Improvement Plan, essentially what they plan to do in response to those needs. So once they identify what those needs are in the Community Health Needs Assessment, then the CHIP says what they're going to do about it. So if you ever get a job in a public health department, or at least get an interview for a job in the public health department, what I would do is I would go online and I'd see first off what they're doing in terms of surveillance, but then I'd go and I'd look at their needs assessment and read through what their needs assessment is. And I'd go through and I'd read what their community health improvement plan is, because if from those two documents, you'll probably get a pretty good idea about what their focus is, or at least what their focus was at the time they wrote them. So the type of information that they put in these types of needs assessments, well, they usually have basic baseline information just about the county. And then what they do is that they go through and that they figure out, well, sometimes they'll just report rates of cancer rates, or they'll report rates of, whatever it is. They'll just kind of report the basic type of health data from the county. They often get this information from the hospital data, and they get it also from what's called the CHIS, the California Health Interview Survey. The CHIS is a big statewide survey that's run every year. It's run out of UCLA. You can go on CHIS. You as we as people can go on CHIS, and you can find a lot of information about the population, the health of people in California. And counties can get it for their county. So what CHIS tries to survey, if not every county. I mean, they survey every county, but they do reports that are sometimes for every county. Sometimes they lump smaller counties together. But for the most part, you can get things like cancer rates and other types of information like that from CHIS. So a lot of what public health departments report then is CHIS information. The other thing they do is that they go out there and they actually, sometimes they go out there and they do their own needs assessments. So I put an article online, which is this one. Let me get it for you here. So this is one that was done by people here at UC Merced. So Kevin Kwan was a PhD student. Fawn, she was a PhD student, but she was also she was at the time the director of Madera's public health department. Hilda just finished her PhD, but she at the time was the assistant director at Madera. And Sidra is an epidemiologist. So they collaborated on doing a needs assessment. So, you can come down here and take a look at the methods section, since that's always the most interesting. Talks about Madera County. Says that they formed a steering committee. All right. Then they did a survey and pilot testing. They trained the interviews. So they went out and they did, they collected data from lots of different types of communities. Then here's the results. All right, well, first off, here's table 1. This is their, basic demographics of their, and then their survey results are kind of down here, and they're reporting the 4 major health concerns in Madera County, right? So alcoholism, drug use, breathing problems, diabetes, etc. So you can see is that, that in this case, a needs assessment that they did like this is pretty similar to the types of it's just research, right? So the types of research methods that we've been talking about is essentially what they use in their needs assessment. So when you go out in the public health department and they start talking about, oh, we want to do needs assessment, is that the way to think about it is just think about it as if it's a research project. And the research project then means that, you're going to go out there and figure out how to set up a survey, how to get a representative sample, how long the survey has to be, etc. So that's what a lot of counties do when they do their needs assessments, is they'll do some type of then the community engagement could just be what they do is they just get together, focus groups of people and discuss things. Or it could be, and because they can do both, and they can go through and that they can do a survey of people. And the survey then is just like the type of survey that we did. You set it up, you get your questions, you identify what you want to come out of it, your research aims, and then you do the survey. Okay, next thing is monitoring. So monitoring then is if you think about, well, what a surveillance does, surveillance comes through and it's talking about how you're going to identify track what's happening in your community. A needs assessment then is a bit more formal, where you're compiling the surveillance information, but also you're getting information from other types of sources, and you're trying to get the community input in terms of what they think are the important needs, and you put that together. Then, from that, then public health departments come through and that they do programs, right? They have TB programs, and they have diabetes prevention programs, and they have health promotion programs, and they have all these different things that they do. And so then, there's sort of the next thing to do is basically just to monitor what those programs are doing. Now, there's a difference between monitoring and evaluation. So monitoring means that you're just following the progress. Evaluating means you're following the progress, but you're trying to make some type of assessment about how good the program is doing. So monitoring, when they talk about monitoring programs, what they mean is that they're just looking at how do you go through and just kind of track what's happening to these programs. That's usually typically the first kind of thing that they look at, is essentially how you go through and just keeping track about what our programs are doing. Evaluation then is when you're saying, well, we have some goal, and that obviously from this program, and we want to go through and then see whether or not the program is meeting its goals. So monitoring then is that if they talk about monitoring, what they're talking about is just the process of just gathering information about the programs. So it could be things like number of participants, are the people who are supposed to be doing the program showing up for the program, all these different things. Evaluation means that you've got some type of assessment in mind, like, well, all right, we want on average 30 people to show up for our programs, and we want there to be different type of health outcomes that come out of it, etc. Monitoring typically means you're just going through and just tracking what's happening. Evaluation means that you've got some type of criteria you're going to compare it to. So know the difference, because if you go out and you start to look at the you start to work in the public health department, and they start to talk about monitoring our programs, is that they're not necessarily talking about evaluation. Well, or if they want you to evaluate, then you need to sort of realize that, oh, they don't want me just to monitor something. They want me to go through and to evaluate it. So to give you the sense about monitoring, how it works, well, so there are different types of oftentimes you don't really get information that you want in terms of what the program is doing. So what they do is that, for monitoring, then they usually break it up into 3 different types of indicators. So one is called process indicators, another one is structural indicators, and then outcome indicators. So process indicators, and this is used a lot in hospitals. So if you go work in a hospital, is that like in Mercy, they'll start talking about their monitoring system, and they'll start talking about their process and structural indicators, because hospitals, huge organizations, a lot going on, they have to try and track sort of how are things going, and it's really hard for them to figure out how things are going in real time. So what they do is they look for what kind of indicators we can get to see sort of how things are doing. So for example, a process indicator is like waiting times in the emergency room. That's a process indicator, because in itself, the amount of time you wait in the emergency room isn't, it's not really a health outcome. But what is that, well, if people are waiting for a long time in the emergency room, that they're going to have worse health outcomes. So process indicators means like, are things going along as you think that they should be working? Another process indicator is percentage of stroke patients with a CT scan. So anyone who comes in with a stroke should get a CT scan. On the other hand, if you're overloaded, if your system is overloaded and or your staff isn't really identifying strokes early enough, is that they may not get a CT scan. So if you see low numbers of patients with CT scans, it's an indicator that something is wrong in your process. Structural indicators then is more about do you just have the basic things in place that you need? So like number of nurses on staff at any one time, on call at any one time. That's a structural indicator, because that there should be a certain number of nurses per patient. And so therefore, if you don't have that, then you have a problem. It can also be something like, do you just have a stroke unit in the hospital? That's a structural indicator. Then outcome indicators, you can imagine, are a bit more hard to actually identify, because outcome indicators, are like for mortality, let's say. Mortality is an outcome indicator in a hospital, but it's hard to sort of assess just basically based on the number of people who die, whether or not you're really, your hospital is doing a good job. So they report type of outcome indicators like this on a routine basis, but because it's hard to sort of get the causality from what you're doing as a hospital to what their outcomes are, is that they focus on these process and structural outcomes as well. And you'll see this type of relationship, like you say, structural and process indicators lead to outcome indicators. So they'll talk about it in terms of this type of process, that your structure indicators, that determines whether or not your process works, and your process determines your outcome. So when so the relationship then between these types of monitoring structural indicators is essentially, do you have the things in place? Is it working well? And what are the outcomes? Now, in terms of the ways that monitoring is done, one of the most important ways that's done in hospitals is what's called case mix. So if you think about, like, let's say you want to use mortality as a way of identifying, whether your hospital is doing a good job. Well, mortality depends a lot upon, how sick people are coming in and what types of pre-existing conditions they have, and all those other type of factors. So you have to, as a hospital then has to think, well, what they really want to know is that they want to know, for a given type of patient, what's our outcome measure? So what that means is that they're trying to control for what the types of patient, and that's what the conditions the patient has, and that's called case mix. So if you go into a hospital and you suddenly start hearing them talk about case mix, what they're talking about is essentially how do we measure and control for the types of health conditions the patients have. People who work in hospitals then work with data in hospitals, or work for Medi-Cal. What they'll do is they take all this patient information and then they try to separate out. They say, well, let's take patients with no pre-existing conditions, and we'll look to see what their kind of health outcomes are versus patients with pre-existing conditions. That's what they mean by controlling for case mix. Also age and gender and things like that. So how do you think about this? Well, you think about it in the same way that we've been thinking about research all the way through. You think, well, let's see, what is it that's going to cause people to have ill health? It's that pre-existing conditions, age, things like that. What type of conditions? How can I figure this out? You go and you look at the literature to see, in the literature, how it is that that people have done this. And so it's essentially just using the same type of research methods that we've talked about. The measurement and collection of data, oftentimes when they're doing this type of work in large hospitals and such, they're going to be using routinely collected information. That means just patient records, right? Whatever's in the digital records. But sometimes they go out there and they do their own type of data collection. So maybe they'll go around and they'll monitor, they'll go around to wards and they'll see, like, what the patient, how long the patient takes to get medications, those kind of things. Well, how do you do that? you do it the same, you set those things up the same way you set up any other type of research project, which is that try to figure out when to do it, how to collect information, how to be inintrusive, all the rest of it. One of the main things you're looking at when you do this then is you're trying to pick out random variation from systematic variation. So, you know, there's going to be like, if you look at just health outcomes within within Mercy Hospital, you'll see it varies across time. Sometimes there's more deaths and more, you know, complications. Sometimes there's less. So what you're looking at that, you know that there's just sometimes just randomly, you know, things happen, but you want to pick out whether there's trends or whether there's systematically, you know, bad things happen or you get poor outcomes at certain types of, under certain type of conditions, under other conditions. What that means is you're trying to pick out random variation from you know, from basically trends. And then oftentimes then what you're doing is you're using this information for quality of care, to assess the quality of care. So for example, if you look at, you know, you want, you're going to look at some type of health outcomes, like, I don't know, the amount of time that wounds take to heal. That's something for which it's a outcome information that you can collect pretty easily, because you know how long the person's in there, and you can collect to see from their electronic records how well they're doing. And so then what you can do is you can set up, like, you know, process indicators to sort of see, well, okay, how often did people get the drugs, etc. And then from that, then what you're thinking is that if you can identify the process about the number of time people get drugs and link it to the amount of time that that their wounds take to heal, is that then you can see whether or not there's some type of problem going on. Okay, so just to show you, this is the types of things that oftentimes they end up looking at in hospitals. So things like, you know, how many people got physiotherapy within the first 72 hours of admission. And what they do is they will compare, you know, within certain points of time or certain conditions to other points of time, etc. So if you, and just to let you know is that if you want to, you can go and you can get a master's degree and basically in this type of doing this type of analysis. So they offer masters, and I think it's under mostly health management, that you can go and get a master's basically to look at how you go through and identify, use big data sets to essentially identify health outcomes. Okay, that's monitoring. Then the last thing is evaluation. So evaluation is what they're referring to when they talk about evaluation, is that there's some type of program, some type of policy, and what you're trying to do is you're trying to assess, does it meet some goals? So again, monitoring differs from evaluation, and that monitoring, you know, you're just recording, right? You're just trying to record as things are going. The process by which you go through and that you then try to assess, you know, are we doing a good job? That's evaluation. So you can see is that there's not really much point in monitoring unless you do some type of evaluation, right? Because why go through and collect all this information if you're not going to turn around at the end of it and do something with it? So evaluation, you know, monitoring leads to evaluation. And sometimes, like in the hospitals, when you do the monitoring, they're going to use that information and say, uh-oh, we've got a problem here. And so what you're doing then is you've kind of now moved into that evaluation phase because you're making some type of value judgment about whether this is good or bad. That's what evaluation means. But the reason it's usually talked about as being something separate from just monitoring is that there are different types of ways that you can go through and evaluate things. So it's not just kind of looking at data and making an assessment. There's also different, like there's a process evaluation and a formative evaluation, and so there's different types of ways. Evaluation is also something, you know, you can go off and get a PhD in doing evaluation. There's been a long debate within health about whether evaluation is research, because the whole point of doing evaluation is to help go through and improve the way that things are done, so that it's very much focused on trying to help the organization or help the whoever it is that's running the program improve the program. The idea of research is that you're doing something to answer some question, and then what you're going to do is you're going to disseminate that information. You're going to publish it. You're going to tell people about it, right? But evaluation is something for oftentimes when people do evaluations, they don't, never, they write a report for the people who are running the program, but they don't publish it. And the reason is because, like, let's say if you're a Mercy Hospital and you're thinking about, all right, we want to see whether or not our care in our emergency room is doing well. Is that, well, you could come to the university and say, university, please come and evaluate us, right? And so we as a university would go out and we'd set up this type of information, set up the systems, we'd gather information, and then we'd go through and that we would then say to them, okay, here's our results. And then we turn around and publish it. And now we can publish it without, letting them know, letting Mercy know, identifying Mercy in there. But still, it means that the information is out there. And Mercy may not want everyone to know that how they're doing on their ER room. They may want it internally, they may want to improve their type of their processes, but they may not want us to write an article about it that says, oh, Mercy's ER room is doing a horrible job. So organizations, they typically don't necessarily want to have, or they're very wary about having external evaluators who are going to come in, who are going to evaluate something, who are then going to go ahead and publish it, right, and make it known. So there's this, and that's the same thing for government agencies as well. Government agencies, they want to evaluate what their policies are and what their programs are, but oftentimes they don't really want, to be public about what their evaluations are of their policies. I mean, you would be, it's like they would say, yes, of course we want the public to know, but they want the public to know kind of what they want to control the message. And if you bring in an outside evaluation firm, is that, who's going to publish it? If you bring in the university, then what you're saying is that, well, we're bringing this university in and we know that they're going to publish the results from it. So typically, organizations, whether it's government organizations and public health departments, or whether it's Mercy Hospital or whether it's Golden Valley, they're very wary about having external evaluations come in that publish the results. So evaluators know this, right? Evaluators, they know that if the whole goal is just to improve the system, and that if by saying that you're going to publish it, you're going to make it so that the organization isn't going to bring you in to evaluate it. So they're not going to evaluate their system, then it never improves. So it's like, from an evaluator standpoint, they say, well, okay, so we'll just evaluate it, but we're not going to publish it. We're just going to give the results to the organization, and then the organization can use that as internal processes to improve. Well, researchers, academic researchers turn around and say, well, wait a minute, that's not research then. An evaluation says, you're right, that's not research. And researchers say, but then how is the world supposed to know how to improve if you never publish? And so that's why you'll see that there's a tension between evaluation and research and academic research, because evaluators tend to see themselves not as doing research, they're just doing program improvement. And academics tend to see that, no, part of the whole scientific method is that you publish things. Okay, so what can you evaluate? You can basically evaluate anything, treatments, services, health policies, how organizations are doing. Evaluation kind of occurs at all these different type of levels. If you go into the Merced Public Health Department, they'll do evaluations of their programs. If you go into any type of organization, it's going to do evaluations. So the steps. Now, not all these steps are often followed, but in theory, the way that if you were brought in to do an evaluation, or if you're working for the hospital and they say, we want you to evaluate, kind of how our service is doing, is that you would just do the same type of steps that you would do for any type of research project process. You look at the background information, Then you talk to people, you engage stakeholders. That could be is that all you're doing is for evaluation, what that often means is that you bring together the people who have commissioned the evaluation, and then you find out from them what exactly it is that they want. Because sometimes when they bring in people to evaluate a program, there's differences of opinion between people in terms of what they think that evaluation is going to do and what it's going to focus on. So the first step in doing evaluation is always to bring in the people who are commissioning the evaluation, and you talk to them about what they're doing. And then what you do is that you write it down. You write it all out and you say, okay, here it is what I hear that you saying is that I'm going to do for the evaluation. And here's my goal at the end of it. Part of the reason you do that is just so you have clarity going forward. But the other reason is that oftentimes when you do evaluation, so oftentimes when you do an evaluation of like some type of service at the hospital, right? You're being asked to do it because the hospital thinks it's doing a great job. And what they want is they want to basically bring in someone who's going to do an evaluation, who's going to just document what a great job that they're doing. And so they can then turn around in their reports and say, look, we did this evaluation and we found that we had, we're doing a great job. So oftentimes when they bring in an evaluation like this, they kind of know what the answer is that they want. They want the evaluators to say what a great job everyone, that they're doing. But what oftentimes happens that once you get in there, you find that it's not always a great job, and that there's problems that arise. And the evaluation to be thorough has to report those things as well. And so there can be a process at the end of it where when you bring the results back to the stake, to the CEO or whoever it is that commissioned it, they get upset because they say, wait a minute, this is what we wanted. And so it's good to sort of write it out before exactly what you're going to do, so that then you can turn around afterwards and say, well, look, this is exactly what it is that I said I was going to do. And so I've done. So it sounds kind of overly cautious, but what I've learned from doing evaluations over all these years is that it's really important to do that, to make sure everyone understands exactly what it is that you're going to do, and that you agree on that before you start. Then what you do is you do a logic model, right? And I'll show you what a logic model is in a second. Based upon the logic model, then you choose your type of evaluation. And then once you choose your type of evaluation, it's just like any other research project. You go out there and you decide how you're going to gather information. You develop a plan. You get a budget together. You then, figure out what you're going to, who's going to do the evaluation. You collect the data. You then process and analyze it, and then you interpret it and disseminate the results. So, in a lot of ways, in fact, in all ways, the evaluation project is not really different from a research project in terms of the types of things that you do. The only thing really, kind of different thing is that you do this type of thing up front to make sure that the organization that you understand what the program is, and that the organization understands what it is that you're going to do, and that then and that you're going to choose your evaluation type based upon this. All right, so program logic. So program logic is evaluators. That's the first thing that typically that they do when they sit down to do this type of consultation, is they'll put together a program logic. And they develop what's called a logic model. And a logic model, what it does is it usually pictorially, it identifies what the project looks like what the stakeholders think the process is for getting to the end, of this program or this service, whatever it is, how they think it works. So I'll show you an example. So this is a paper that I put online for you. Public Health Program Planning Logic Model for Community Engaged Type 2 Diabetes Management Prevention. So Comes down and it's, has the same type of format as usual things. But then this is what they come up with. This is what a logic model looks like, where, notice it says up here, what we invest, actions we take, the people we reach, what we learn, how we respond, and the impact we make. And so then what we invest, this is the, case management, clinical care, CEPI, whatever that is. And then our measurable outcomes, outputs. And then in this, we'll talk about an evaluation, they usually make a distinction between outputs and outcomes. So outputs, you can think about those as being like process things, and outcomes is basically the types of outcomes that result from a program or policy. And you notice is that they break the outcomes into short-term, intermediate, and long-term. Up here, short-term, intermediate, and long-term outcomes. And then down here below, they have the evaluation and monitoring feedback loop, which is essentially saying is that, well, so they're evaluating how things are going all the way through and then feeding back in to sort of improve the program. So that's a logic model. So evaluators, what they'll do is they'll set up these types of logic models during the process of the stakeholder engagement, so that they can go through and that they can show it to the stakeholders, and everyone then get their agreement that yes, this is how we think the system works, and these, more importantly, these are the types of outcomes that we're going to measure from that result from it. Okay. All right. So that's a logic model. Then what you do is you choose your type of evaluation that you want to do based upon, once you've done your logic model, you choose your type of evaluation. So there are essentially a number of different types of evaluations you can do. You can do a formative, substantive, a process, outcome evaluation. So we'll talk about those three. But like you can also do an economic evaluation, you can do a policy evaluation, you can do a meta evaluation. So there are different types of ways you could do it. The difference between these things is that a formative evaluation is something that you do, you're not looking at outcomes. You're doing it as the program is kind of being developed or just starting. A process evaluation kind of identifies, is it running as it should run? And outcome evaluations where you try to measure the health outcomes, either short-term, intermediate, or long-term. Economic evaluation is where you try to figure out whether it's cost-effective. A policy evaluation then is when you look at it in the context about how does the program kind of fit within our broader kind of what we're trying to do within the healthcare setting. And then a meta evaluation is sort of like overall, trying to get different types of programs together to do kind of a, how good are we using all these different programs of meeting whatever our main policy goal is. But we're just going to talk about these three. So a formative evaluation takes place when you're just before the project starts. And so the idea behind a formative evaluation is that what you're trying to do is you're trying to look at how they're designing the program and then give them feedback about that suggests whether or not the program is doing, whether they're doing a good job or not. So if they bring in someone to do a formative evaluation, oftentimes what they do is that person then, gets brought in as the project is being developed, right? So, if you're in the public health department and they're going to develop a diabetes prevention project and they identify, here's the staff that are going to develop the project, the formative evaluation occurs right when they're starting to develop it. And so they come in and that they then, the evaluator will sort of come through and will be part of the process. Like I did a project a few years ago with Merced Public Health Department. It was they were doing a diabetes prevention project, and they got a grant from some big foundations to basically implement this. And it was a 3-year project, of which the idea was that the first year would just sort of be developing the project. The second year would be, kind of figuring out how to do it. And then the third year, they'd actually do it. So that was the was the basic process. And the funding agencies that, that funded this, they hired a company that, some evaluators to come through and to do a formative evaluation. And so, we would be meeting every week, every month. We as sort of the group within Merced who was putting this together would meet every month. And we'd have these meetings. And then about every 3 or 4 months, the evaluation team would come in. And the evaluation team would come in and sort of ask how things are going, and they talk to us, and they would, try to get a sense about how's the project being developed. And in theory, what they should have done then is they should have just written back a report and said, so here's what we see. We see that there's tension between these things. We see that, your ultimate goal is to develop a diabetes program, but we see these types of barriers along the way. So what they should be doing is giving feedback along the way that sort of helps the group kind of say, oh, okay, so we need to put more emphasis on this. So these are almost always qualitative type of methods, what they're using. And so they're using, like focus groups, and they're using, talking, interviews and things like that. But they're using not formal type of qualitative assessments. That is, that they don't write things up like we do a qualitative paper. Instead, what they're doing is they're just feeding back information back to the organization. And then the organization, use that information to improve it. So I went looking, I found actually a formative evaluation for you to look at. So let me pull it up here. So here you go. An evidence-based formative evaluation of a cross-cultural Aboriginal mental health program in Canada. So, research, and I should mention that it's actually hard to find articles that are published like this, because people typically don't publish them, right? They typically do them, evaluators come in and do them, and then they don't do them as academic publications. These ones are all, they're usually from academics who are doing this, or people who are associated with academics who publish these papers. So it goes through same type of thing, talks all about the context of it down here. And then this is their methodology. A formative approach evaluating grounded qualitative inquiry was chosen. And so talks about who their sample is, and then how they, how they collected the data, and then how they did the data analysis, ethnic considerations, and then finally down here is their findings. And so you can see the findings is, written up like a qualitative study. But what they're doing now is they're focusing upon the, upon basically the, they're giving feedback in terms of what type of factors should be included in the program itself, right? So what are the important factors that the program should consider? So relationships, empowerment, self-awareness, focusing, healing circles. So what they're trying to do then is they're trying to say, okay, so when you're developing this intervention, here's the factors that you need to consider along the way. So then here's the, implications for that talks about the implications for the for developing the program, and that's about it. So that's a formative evaluation. It's done kind of before, as the process is just getting started, and the idea is that you're providing information that they should go through and that they should use to develop the program. A summative evaluation, it sort of takes place, during the project, and then during when the project's being implemented, and then after it does get implemented. So if you think about like a formative evaluation, essentially how you develop a program, a summative evaluation is how you actually implement it. So take the diabetes program I was talking about in Merced. So the formative evaluation came through and looked at how you're going to develop a diabetes prevention program. And what this group finally decided was that they were going to essentially focus on upon the CDC's diabetes prevention program, which is a kind of a 20-session type of program that the CDC makes available and that people then offer. So it's being offered like Mercy offered it, classes in it, and Golden Valley offered classes in it, and Public Health Department offered classes. So what this group decided was that they were going to basically, try and coordinate all these and support them. So financially support them, but also, do an outreach program to get more people kind of into them. So that was the program they developed. The way that they were going to do it, actually get people in the program, is they were going to use a telephone kind of hotline where people could call up and they'd be referred to these. And then within each of the different types of classes is that then they would do outreach to these people to try and encourage them to join the program. And that they would then go ahead and actually, once they joined the program, they would give them support along the way. So that was the basic type of program. Well, so the formative evaluation dealt with coming up with that model. The summative evaluation, what that dealt with is essentially how you're actually going to go through and how this phone line is going to work, what the counselors are going to say when they get referred, when people are referred to them, how are they going to go through and actually encourage people, all that kind of thing. That's the more implementation type of process. That's a summative evaluation. You can says here that they can become blurred, a formative and the summative evaluation, which is true because oftentimes, the information, like if you come through in that and doing an implementation evaluation and you're say, well, you're referring people via this phone line, no one's going to call the phone line, then you may have to change the program. So it may be is that the information that comes out when you actually try to implement it, changes the way that the program is done. But that's the whole purpose. The purpose is to essentially end up with making sure that you have a program that you think is going to be, is going to theoretically do what you want, and that implementation wise it can work. And if the implementation is not going to happen, then you have to change the program. But that's a summative evaluation. I found an article on the summative evaluation. So it looks like this. So a summative evaluation, so I'll let you go through and look at it, but you can see it's again set up exactly. The purpose of the study was to conduct a summative evaluation of traditional and social media food marketing's 4-day throwaway or awareness. So it talks about how to do it, and then they set up their materials and they go through. They talk about the materials, how it was set up, and so here's all the materials, and then how they evaluated, and then their results. And we go down the results. So the results kind of look like this, right? Is that they're going through and they're reporting essentially the number of different sites that did different things and such like that. So that's a summative evaluation, is they're focusing upon the implementation process. Process evaluation. Process evaluation is asked, are the activities, is the program going the way that you think it's going to go? So if you think about the diabetes prevention program in Merced, you had formative evaluation develops a program. You have a process, a summative evaluation that would go through and sort of say, well, are they doing? It can be implemented. Then the process evaluation says, is the program working like it should work? So process evaluation occurs during the program itself. It's not an outcome evaluation because you're not looking at whether or not the program is achieving its ends. It's just sort of saying, like, are classes being run? So, are there classes at Mercy and at Golden Valley that people can actually attend? Do counselors show up? Do they offer the 20 steps, 20 classes, these types of things? Those are all process evaluations. Is the phone line working? Is the phone line referring people? So you can see is that a process evaluation is not about, is this doing a good job? It's just about, is it doing what it should do? And so typically when you do a process evaluation, what they do is they refer back to the logic model, because the logic model should lay out kind of the, well, we're doing this step to this step along the way. And so, what a process evaluation should do then is sort of take the logic model and say, well, okay, so it said that you were going to refer people to these classes. is the referrals happening? It said that you were going to, once they're referred, the counselor is going to call them up. Is the counselor doing that? So process evaluations, become much more kind of focused on the what exactly it is that they're doing. So it's often referred to as the who, what, when, and where questions. Who did the program? To whom did you direct the program's effort? What's the program done? When did the program's activities take place? Where did they take place? What are barriers or facilitators to make the programs happen? So I've given you an article here to kind of look at for this. So if you look at the not that one. Where is it? Well, it's the evaluation of the Black churches. So I'll tell you what, why don't we stop there, because the next thing is outcome evaluation, and I won't have time to deal with that. So we'll deal with outcome evaluation kind of at the start of next class. Any questions about anything? Will office hours be through Zoom? Yeah, I won't have office hours today. I'll have office hours on Thursday, and they will be through Zoom. And I'll send you the Zoom link again, but it'll be on Thursday.
So the final exam will be like the same format. It's going to be all written response, correct?
That's correct.
Okay. Thank you.
When the assignment, assignment 5 will be posted later on today.
Is the final gonna cover everything from the class or just after midterm too? I mean the midterm.
Yeah, if you look at it will be mostly after midterm too. If you look at this, so if you go online and you look at the this file, this shows, it says, here's the things you need to know before the midterm. So they're just the basic type of things that we've talked about. And then it says, here's all the things since the midterm. So the final will cover, you should know these things, like what independent and dependent variables are, right? But then these are the types of things that we're going to cover that we've covered after the midterm, which is, about evaluation, and that we talked about the role of researchers and team science. And then we also talked about, reliability and validity and things like that. So those are all things that we'll cover, that we've covered since the midterm.
Okay, thank you.
Other questions? Okay. All right. Well, I'll see you Thursday.